Welcome to this special segment. We often come across questions on ovulation testing. We are delighted to welcome a distinguished expert in healthcare and public health, Dr. Deepak S. Jois. Dr. Deepak, a very warm welcome to the Premom Podcast.
Hi, thank you for the invitation. Since you are talking on home-based kits today, so more and more people are utilizing it, and that's why it's very important to focus on this and make more awareness about this.
Okay, let's start with the basics. Millions of women in India rely on at-home ovulation test kits to find their fertile window. From a clinical perspective, why are home ovulation strips so valuable and why are they the perfect tool for a woman tracking a cycle?
Yeah, ovulation can be detected indirectly by LH surge, what we call as luteinizing hormone, which usually rises 24 to 36 hours before the ovulation. So it is not a direct method. Most of the home-based kits or even laboratory where we measure the LH usually focus on this LH surge. So LH surge is detected in the home-based kit, which is an indirect measure of ovulation. So I think it is the convenience and the privacy which actually matters most, where more and more people are using these home-based kits. And this is an era of data. So more information, more the data, you can better plan your things or pregnancy. So that's why home-based kits are more in demand nowadays. Yeah.
Okay, so for our listeners who might be nervous about stepping into a clinic, what exactly happens in a lab-based ovulation or fertility test that an at-home kit cannot simply provide?
Home-based test kits are qualitative in nature. Okay, so they will tell you whether it is positive or negative, but it will not give you an exact value. So how much is the LH hormone value? Okay, so that can be detected in the lab. Why this matters? Because in case of polyendocrine metabolic syndrome or PCOS, the baseline of the LH will be more. So in these cases, it will be difficult to detect the LH surge because the cards will always give you a positive reading. So there are many medications which and hormones which can interfere with these tests, where a lab test can be without the interference. So these are the main reasons where will actually help by doing a lab test than a home-based test kit.
So we get a clearer picture, a more elaborate picture when the tests are done at lab.
Yeah, definitely. So there are many other tests also, which where you can do a progesterone test on 21st day, which cannot be done on any kit. So and you can go for ultrasound and so many other diagnostic tests to detect ovulation, even directly. These tests are actually predicting the ovulation indirectly. There are other methods where you can detect it directly. So that's why the advantages are there with the home-based test kit also and with the lab test also. So it has to be taken very judiciously with a doctor's consultation.
Thank you so much, Doctor, for helping us understand how to balance home comfort with lab precision.
Thank you. Thank you very much for the invitation. Thank you.
To our viewers, whether you're scanning your easy at home strips or getting a lab panel done, Premom India is here to help you own your fertility journey with clarity. Stay informed, track smart, and take charge of your health. Thank you so much for joining us today.